Hello, I'm Jose Domingos, President and CEO of Accreditation Commission for Healthcare, or ACHC. When I joined the organization 6 years ago, my primary mission was to align our workforce in order to be dedicated to our mission. Once we did that, we found the results would follow. ACHC is a nonprofit accreditation organization that has stood as a symbol of quality and excellence for more than 30 years. In addition to our presence in pharmacy, ACHC also offers internationally recognized accreditation services for home health, hospice, and private duty agencies. ACHC has earned CMS Deeming Authority for home health, hospice, and DMEPOS, and our quality management system is certified to ISO 9001-2008. Since the introduction of our pharmacy accreditation program in 1996, and as the first accrediting body to offer accreditation in specialty pharmacy, ACHC has grown to become a leading international accreditation organization with more than 6,000 pharmacies accredited in the US and Canada. We are regarded as the total solution in pharmacy accreditation, with a broad array of pharmacy compliance offerings, including accreditation programs for community retail, specialty, infusion, and long-term care, as well as sterile and non-sterile compounding services through the Pharmacy Compounding Accreditation Board, or PCAB, a division of ACHC. We are positioned to be the solution of choice for all clinical settings, as well as for payors, manufacturers, and regulatory bodies. We strive not only to offer the industry's premier compliance programs, but to align our service menu with our customers' business and expansion needs. In that spirit, ACHC has taken additional steps to meet market needs by developing distinction programs in oncology and HIV, as well as hazardous drug handling compliant with USP 800. With a comprehensive suite of educational resources and consulting options, ACHC is not only committed to providing the industry's benchmark for accreditation, we're also committed to helping pharmacies achieve and maintain continuous compliance. Perhaps the greatest advantage to choosing ACHC is our broad menu of accreditation services. With programming in specialty pharmacy, infusion, long-term care, and compounding, we are aligned to meet both the current needs as well as the aspirations of our customers. As you grow, either organically or through acquisition, we are there to help you succeed. Another benefit our customers tell us holds value is our wide acceptance by payors, PBMs, and manufacturers, as well as our ability to meet the scheduling needs of well-prepared pharmacies seeking accreditation. And as for preparation, our Accreditation University Division provides a diverse and comprehensive menu of educational components, including webinars, workshops, policy manuals, as well as numerous consulting options. Our surveyors have many years of experience in their fields and provide consultative guidance to our pharmacy customers. We truly do regard accreditation as a partnership, in that not only do we have a vested interest in helping pharmacies prepare for and achieve accreditation, but also to thrive and succeed in their practice. Managed care organizations, policymakers, and others charged with improving the healthcare journeys of patient groups have found value in ACHC pharmacy compliance solutions. ACHC accreditation offers an innovative solution that effectively addresses cost avoidance, patient access, and customer needs and expectations. ACHC has the broadest base of accredited specialty pharmacies in the industry, with standards that require adherence, medication management, and ongoing performance improvement. Similarly, PCAB accredits the compounding industry's largest network of pharmacies. PCAB's customizable standards ensure adherence to USP 795, 797, and 800, and also include ongoing performance improvement along with annual verification of compliance. ACHC and PCAB are industry leaders in customer service with relevant standards that are validated by ISO, CMS, regulators, and payors. Aimed at improving patient outcomes, ACHC standards are robust and customizable to meet the unique needs of specialty plans. ACHC is an independent accreditation organization that supports the network credentialing process by ensuring the pedigree of provider pharmacies. We do this with a comprehensive organizational review and on-site survey. ACHC's distinction programs allow for an additional point of credentialing validation. This ensures that the capability and commitment to continuous improvement of pharmacy serving your members. By embracing managed care goals of improving patient outcomes across the pharmacy continuum with the utmost regard for safety, efficiency, and patient access, ACHC and PCAB are positioned to be your partners in this dynamic and critical mission. Accreditation University began as an outgrowth of ACHC's rapidly expanding educational service lines. The tremendous interest in these offerings made us abundantly aware of the desire that was out there for more education and support in helping pharmacies prepare for their surveys. What began as two products, workbooks and workshops, emerged in 2014 as an entirely separate division within ACHC, now offering a wide array of products and services, including an expanded workshop schedule with offerings across the U.S. as well as internationally. Live and on-demand webinars, the Accreditation Guide to Success Workbook, survey tools and survey readiness checklists, industry-tested policy manuals, as well as consulting services accessible at many different levels. We also provide training for consultants who wish to become certified to ACHC standards, and we utilize only certified consultants in any recommendations we make to pharmacies and agencies. Our customers represent a very diverse profile, large and small, startup and established, franchises, corporate and small proprietorships. It is not a one-size-fits-all approach. We continue to expand and modify our offerings to meet our customers' needs. In each case, it would be fair to say that preparation is the key to a successful survey, and education is the key to an organization being well prepared. First and foremost, we concentrate our efforts on the overriding needs of the industry to ensure that we bring value at multiple touchpoints. Consequently, we have been able to develop a menu of relevant accreditation programs that have breadth, including specialty, infusion, long-term care, community retail, and compounding pharmacy, as well as depth, which includes specialty at retail and the industry's first distinction programs. When you combine our accreditation programs with services that help pharmacies prepare for accreditation and improve their operations, it becomes apparent that we are investing in a dependable, credentialed, highly qualified network of pharmacies on which patient and prescribers can rely. We are constantly working with regulators, payors, and manufacturers to improve and customize our offerings to meet network requirements and provide value-added services to pharmacies so that our accreditation programs are recognized, relevant, and hold value in the market. Driven by our mission, ACHC is dedicated to delivering the best possible experience in everything we do to help all pharmacies we accredit remain focused on the patient journey.
Hi, my name is John Pritchett, Associate Director of Pharmacy with Accreditation Commission for Healthcare. I oversee our compounding operations, which includes PCAB accreditation and ACHC inspection services. PCAB, the Pharmacy Compounding Accreditation Board, is an independent, not-for-profit accrediting body, widely recognized for being the gold standard for compliance with the industry's key benchmarks for quality and safety, USP 795, 797, and 800. Our surveyors are a key component to promoting safety. We have the industry's most seasoned team of surveyors. All of them are pharmacists with significant experience specific to compounding. Our standards are based on USP guidelines and concentrate on the actual practice of compounding. Unlike other compliance programs on the market today, PCAB is a very focused, hands-on, and consultative experience. We're not merely looking at operations on a given day. We are working with pharmacies to identify deficiencies and implement solid corrective actions to help them improve. I can tell you from personal experience, having worked as a compounding pharmacist and having been a PCAB customer, the value of a consultative survey with a surveyor who has actually worked in compounding cannot be overstated. The survey helped us not only address areas of deficiency, but also become a better, more efficient pharmacy. Today, more than 600 pharmacy locations across the U.S. and Canada have earned PCAB accreditation for their compounding operations. We've just launched a distinction program for hazardous drug handling, and PCAB has been recommended by both human and veterinary prescribers. For these and other reasons, it is not surprising that PCAB continues to gain the endorsement of policymakers, associations, and boards of pharmacy. While conversations continue around hazardous drug handling and the implementation plans for USP 800, few would dispute the need to ensure the safety of healthcare workers and the general public when dealing with hazardous drugs. That stated, cost and logistical concerns around compliance with USP 800 continue to loom for pharmacies, considering how this new guideline will impact their operations. PCAB has been at the forefront of discussions around USP 800 nationally, offering perspectives on compliance, providing insight and guidance to pharmacy customers, and facilitating dialogue between stakeholders. Proactively positioned to address market need, PCAB is the first accreditation body to introduce a distinction program for USP 800 for the handling of hazardous drugs. This optional program effectively addresses the industry's safest standards for practice for pharmacies that are either currently or moving quickly toward compliance with USP 800. Earned in conjunction with ACHC pharmacy programs, this distinction is optional for pharmacies that are ready now to measure themselves against the industry's highest standards and wishing to distinguish themselves in the market. With a significant national focus on pharmacy compounding practices, PCAB has been attracting attention and a number of unsolicited endorsements, both from stakeholders as well as influencers and regulators. In the wake of national policy recommendations for sterile compounding made by the Pew Charitable Trusts, the Medical Innovation Impact Index published a report cited in Forbes magazine that recommended state licensing boards require accreditation by PCAB or an equivalent body as a condition of licensure for pharmacies. In addition, the U.S. Government Accountability Office recommended that purchasers of compounded drugs utilize PCAB-accredited pharmacies. As for clinical support, both human and veterinary practitioners have weighed in on the value of PCAB in their industries. The American College of Rheumatology, the American Veterinary Medical Association, and the American Association of Equine Practitioners have all endorsed PCAB. These, as well as other affirmations, speak to the recognition PCAB has earned from stakeholders, regulatory bodies, and policymakers, both for its relevance as well as its effectiveness in helping to address a significant area of concern within the public health domain. As attention shifts towards standardized means of ensuring the safety and effectiveness of compounded drugs across the U.S., more and more regulators and state pharmacy boards are requiring PCAB as a means of demonstrating compliance with the industry's highest standards, USP 795 for non-sterile drugs, USP 797 for sterile drugs, and now USP 800 for hazardous drugs. Many states are now utilizing PCAB or ACHC inspection services as a method to obtain non-resident licensure in their states. The reason these states regard PCAB and AIS as their best solution? It's our surveyors and our process. Our highly trained and qualified pharmacist surveyors have on average more than 10 years experience specific to compounding. It is one thing to send a pharmacist to survey a compounding pharmacy. It's quite another to send in a surveyor who has actually worked as a compounding pharmacist for 10 or more years. States that select AIS to perform their state inspections find value in the customizability of our inspections, the ability to add sampling requirements, and the speed and seamless electronic process for transmitting results back to the state. They also appreciate that there is no cost impact to the state for conducting these inspections and ensuring compliance. A current listing of states that accept AIS can be found at our website.
Hi, my name is Roy Bigler, and I'm the National Accounts Manager for Pharmacy, DMEPOS, and Sleep for ACHC. In 2002, ACHC was the only national accreditor to recognize the unique nature of specialty pharmacy as the practice was just beginning to emerge. Consequently, we were the first to develop an accreditation program for this critical mode of patient care. Fast forward 15 years, and we have more accredited pharmacies than any other accrediting body. We are accepted by CMS for Medicare billing and by major payors throughout the United States. As part of your due diligence in selecting an accreditor, it would be good to ask those you are considering how broadly their program is accepted. And, given that time is a precious resource, also ask what their current lead time is for completing the accreditation process. Our knowledge of the unique and demanding nature of specialty pharmacy from various stakeholder perspectives has been informed by experience. ACHC understands your business. We recognize the value of having a broad range of services. Knowing many of our providers serve patients across an extensive continuum, we offer a complete compliance solution that covers specialty, infusion, long-term care, community retail, and compounding pharmacies. With the highly managed distribution channel in specialty pharmacy, a key success factor is a pharmacy's ability to differentiate itself and demonstrate its capability to payors, manufacturers, and PBMs. ACHC's growing specialty distinction programs, which presently include oncology, HIV, and hazardous drug handling, which is based on USP 800, underscore our alignment with the needs of the market. We set a high bar for utilizing these very challenging classes of drugs, which in turn identifies those pharmacies committed to meeting these more rigorous standards. Remember, the key question to ask any accreditor you are considering is, beyond offering a compliant solution, how do you demonstrate your commitment to the evolving needs of your customers? At ACHC, we recognize the need for providers to differentiate themselves in an ever-evolving and increasingly competitive market. ACHC's distinction programs are a demonstration of our sensitivity to the business needs of the industry. Collaborating with industry experts, providers, and managed care organizations, ACHC has developed enhanced standards in key treatment areas. Organizations like AIDS Healthcare Foundation, the Community Oncology Alliance, the International Academy of Compounding Pharmacists, the National Hospice and Palliative Care Organization, as well as pharmacy schools at Fairleigh Dickinson and Campbell University have all played a role in developing these programs. Designed as add-on options for ACHC accredited organizations, these distinctions allow providers to demonstrate a higher level of specialization and commitment to quality. Just as we were the first to offer an accreditation in specialty pharmacy, we were the first to offer distinctions for specific disease states aimed at improving patient outcomes, while highlighting those pharmacies that possess the necessary capabilities to treat these patients. It was for this reason that in 2016, we launched the industry's first distinction program with a focus on oncology. We followed that with 3 additional accreditation distinctions, one for HIV, one for palliative care, and one for hazardous drug handling compliant with USP 800. One thing is certain, the market will continue to evolve, and so will ACHC's programming. Growth-minded pharmacies focused on innovation and continuous improvement will find ACHC to be a ready partner in their pursuit of an enhanced patient journey and improved market standing. One of the many things that sets ACHC and PCAB apart is our surveyors. In keeping with our consultative approach, we only hire surveyors who have significant experience in the specific area they will be assessing. Additionally, only surveyors with relevant experience are sent to conduct surveys on behalf of a given service line. As an example, only pharmacists are sent to conduct pharmacy surveys. We think that's important because an experienced working pharmacist will be more familiar with the environment, workflow patterns, staff, and patient issues in the pharmacy. They know what to look for, and their experience benefits our pharmacy customers. We believe there is value in the pharmacist-to-pharmacist interaction that occurs during the survey. In fact, that's a good question to ask of any accreditor you may be considering. Do they use only experienced pharmacists as pharmacy surveyors? When it comes to delivering an outstanding survey, training is just as important as hiring. A highly structured, precepted onboarding of all new surveyors, along with biannual training and peer-reviewed monitoring of performance, all aim to ensure that ACHC surveys are uniform across the organization and that interpretation of our standards is consistent from one surveyor to the next. It is important that pharmacies that have used ACHC standards to prepare for their survey find the process to be an extension of that preparation. Our goal is there should be no surprises, and the experience should be illuminating, educational, and aimed at helping a pharmacy improve.